Thank you. It is 1:34 on Wednesday afternoon, and I'm calling to order the Assembly Committee on Health and Human Services. Members, before we begin, make sure you mute your microphone when you are not speaking to minimize background noise, and also please turn on your camera so we can ensure that we have a quorum. Madam Secretary, please call the roll.
Assemblywoman Benitez Thompson.
Here.
Assemblywoman Black.
Here.
Assemblywoman Gorlow.
Here.
Assemblyman Hafen.
Here.
Assemblywoman Krasner.
Here.
Assemblyman Matthews. Assemblyman Orentlicker.
Here.
Assemblywoman Peters.
Here.
Assemblywoman Summers Armstrong.
Here.
Assemblywoman Thomas.
Here.
Assemblywoman Titus.
I am here.
Chair Nguyen.
I am here. I also see Assemblyman Matthews waving. I don't know if he's having some computer problems. Do you want to try it again? Assemblyman Matthews, do you want to try to? No, he's definitely not working. If we can have someone come over and try to help him while we do it, but I will note that he is obviously present here. Hopefully he can hear us, gauging by his reaction. He can clearly hear us. So if we can get someone to fix that, that would be great. It looks like he's going to try to get onto another device. Yep, see, look at that. I'm good at charades. So with that, we have a quorum. Everyone is present. So welcome to our audience joining us on this virtual hearing. Today, we have a very ambitious agenda today. So we have a work session and 3 bill hearings. And before we begin, I just want to make several housekeeping announcements. Agenda items may be taken in a different order than listed. In fact, they are going to be. So be prepared to follow along with the agenda as we skip around. Also, you may, if you want to submit public comment, either in writing or in addition to testifying or in lieu of that, please note that on all these bills, written public comment may be submitted before, during, or up to 48 hours after the meeting adjournment today. So if you are not able to get online, you don't want to get online, you don't want to wait on the phone, but you want to have your voice heard, please feel free to do so in writing, and we can get that out to all of our committee members. And finally, if you can put your everyone is kind of working like we're all teenage gamers. And so if you see people looking at other devices, they are just trying to utilize this new virtual world and all of their devices to be able to inform themselves best on the bills that are being presented before us. And with that, we will start with our work session. If you will note for the members and the public, initially we had a couple of other items on the work session. Assembly Bill 181 and Assembly Bill 182 were temporarily removed from the work session document. So we will begin actually out of order with Assembly Bill 189. So Mr. Ashton, if you could go ahead and summarize the bill and the amendments, and we'll start there.
Thank you so much, Chair Nguyen. For the record, Patrick Ashton, Legislative Council Bureau. Just my usual disclaimer, as nonpartisan staff, I can neither advocate nor oppose any measures that you will consider today. We will start, as the chair said, with Assembly Bill 189, which we heard on March 10th. This bill requires the Director of the Department of Health and Human Services, DHHS, to include in the state plan for Medicaid a provision that pregnant women who are determined by certain entities to qualify for Medicaid are presumptively eligible for Medicaid for a prescribed period without applying for enrollment in Medicaid. There's one amendment. Assemblywoman Michelle Gorlow proposes to revise AB 189 to, first, expand coverage for pregnant women in the manner prescribed by AB 193, and second, require DHHS to apply for a waiver of certain federal requirements so that the department may expand coverage under Medicaid from 60 days to 12 months following childbirth. See also attached the proposed conceptual amendment to AB 189. Madam Chair?
Thank you. And members of the committee, do we have any other questions prior to this? I am going into my gallery view. Hopefully Assemblyman Matthews is back on. I don't know if it's working.
Can you hear me now?
Yes, I can hear you now. Wonderful, wonderful. Do we
My
have any
apologies.
questions though? Seeing none,
Madam
do
Chair.
I have a motion?
A motion to pass. Hafen.
Thank you. Do I have a second?
I'm sorry, real quick clarification. Was that a motion amend and do pass? My hearing might be off.
I believe that's what he said. If he didn't, can you clarify?
Clarification, amend, and do pass.
And do I have a second?
A second motion.
Thank you. I see a second from Assemblywoman Krasner. At this time, any comments on the motion? Seeing none, Madam Secretary, can we take a roll call vote?
Assemblywoman Benitez Thompson,
Yes.
Assemblywoman Black,
Yes.
Assemblywoman Gorlow,
Yes.
Assemblyman Hafen,
Yes.
Assemblywoman Krasner,
Yes.
Assemblyman Matthews,
Yes.
Assemblyman Orenlicker,
Yes.
Assemblywoman Peters,
Yes.
Assemblywoman Summers Armstrong,
Yes.
Assemblywoman Thomas,
Yes.
Assemblywoman Titus,
Yes.
Chair Nguyen.
Yes, and that motion carries. If we can go to our next bill on work session, Assembly Bill 119. Mr. Ashton, can you go ahead and present the summary of the bill?
Thank you, Chairwoman. For the record, Patrick Ashton, Committee Policy Analyst. AB 119, we heard this bill on February 22nd. It revises provisions relating to the Maternal Mortality Review Committee. I will go straight to the proposed conceptual amendment from Assemblywoman Thomas. You can find a copy of this conceptual amendment attached to the work session document. First amendment, revise the duties prescribed in paragraphs C and D of subsection 1 of section 1 of the bill to, first, remove the requirement that the committee collect data, and second, remove any requirements relating to preventable infant death. Instead, require the committee, within the limits of available resources, to identify and review the disparities in the incidence of maternal mortality by analyzing the race, ethnicity, and age of each mother who died from maternal causes, the geographic region in which each maternal death occurred, and any other variables identified by the committee. Amendment 2, revise the duties prescribed in paragraph F of subsection 1 of section 1 of the bill to require the committee to collaborate with the Advisory Committee for the Nevada Office of Minority Health and Equity, Office of Minority Health and Equity of the Department of Health and Human Services in developing its biennial report, and clarify that any such collaboration does not grant the office access to confidential information. Amendment 3 is to add a new section to the bill that makes the bill effective upon passage and approval. And the last amendment, number 4, adds certain assembly members as co-sponsors to the bill. Madam Chair?
Thank you. Are there any questions or comments on the bill? It looks like we have one from Assemblywoman Titus.
Yes, thank you for some clarification. I'm just looking at this, the amendment, and under the First Amendment, you're not going to collect any data on preventable infant deaths. So that would be an interesting concern that I have, and now I have some concerns over this bill, because one of the things that we wanted to do was make sure we had adequate data and accurate data on all infant deaths. There are many deaths that can happen that would be determined preventable, such as when a mother has preeclampsia, if she had adequate intervention and she's seized because she wasn't treated and the baby dies, that's a preventable death. Deaths from diabetes because the mother had untreated prenatal diabetes. The baby is large at birth, at term. The baby dies at birth because it is too large and goes post-date without any intervention. That is a preventable death. So I'm concerned that there's going to be any stipulation on who's going to determine what a death was preventable or not. And adding that amendment, I am now not sure that I can support this.
Do we have any other comments or I think our bill sponsor is on here, Assemblywoman Thomas. Do you have any response to why that amendment is?
Yes, ma'am. Thank you, Madam Chair. I appreciate it. I appreciate Assemblywoman Titus's concern. The reason why I felt and DHHS felt that we could best address infant mortality would be with another bill, so that we can signify everything that would cause, just like you stated, all of the references to infant mortality. This right now cleans up maternal mortality, which would identify those mothers that experience mortality with causes of pregnancy, and just have another bill at another time that address infant mortality.
Thank you.
And I think we also may have a representative from DHHS here if you have any other further comments. I'm looking around. Like I said, I have two screens here.
Well, thank you, Chair. For the record, Vicki Ives, Division of Public and Behavioral Health, Maternal, Child, and Adolescent Health Section Manager. And just to expand on the points made by the sponsor, determination of preventability is part of the Maternal Mortality Review Committee process. It's really the heart of their work. So the cases are abstracted, and the committee determines preventability to address that. And generally, no other maternal mortality review committee in the nation also is looking at infant mortality. That would be done through a fetal infant mortality review. And again, preventability could be discussed in the context of the committee's work.
And a follow-up, if I might, Madam Chair. So
Yes, go ahead, Assemblywoman Titus.
The whole purpose of the bill, and again, I signed on to this bill, was that we indeed do need to gather the data so that we could prevent bad outcomes, so that we could prevent maternal and infant deaths, and that I'm in favor of that and supportive of that. But just wanted a clear understanding why that paragraph was removed. So thank you for those answers. Thank you, Madam Chair.
Thank you. Any other further questions? Seeing none, I would entertain a motion at this time.
Move to amend and do pass.
Thank you, Assemblywoman Benitez Thompson. Do I have a second?
I'll second Assemblywoman Gorlow.
Thank you. Second from Assemblywoman Gorlow. May we take a roll call vote, Madam Secretary?
Assemblywoman Benitez Thompson,
Yes.
Assemblywoman Black,
Yes.
Assemblywoman Gorlow,
Yes.
Assemblyman Hafen,
Yes.
Assemblywoman Krasner,
Yes.
Assemblyman Matthews,
Yes.
Assemblyman Orenlicker,
Yes.
Assemblywoman Peters,
Yes.
Assemblywoman Summers Armstrong,
Yes.
Assemblywoman Thomas,
Yes.
Assemblywoman Titus,
Yes.
Chair Nguyen.
Yes, the motion passes, and I will assign the floor statement to Assemblywoman Thomas, and if we could actually go back to Assembly Bill 189, I forgot to assign the floor statement. If I could assign that floor statement on Assembly Bill 189 to Assemblywoman Gorlow. With that, if we could move on to our next Assembly Bill, which would be Assembly Bill 191. And Mr. Ashton, can you go ahead and summarize that bill and any amendments?
Thank you, Madam Chair. Assembly Bill 191, we heard this bill on March 8th. It requires the Director of the Department of Health and Human Services to include an estate plan for Medicaid coverage for the services of a community health worker who provides services under the supervision of a physician, physician assistant, or advanced practice registered nurse. There were no amendments.
Committee, do we have any questions regarding the bill? Seeing none, I'd entertain a motion.
So moved.
I have a motion from Vice Chair Peters. Do I have a second?
Second,
Oh, I don't know who that was from.
Assemblywoman Thomas.
I have a second from Assemblywoman Thomas. Madam Secretary, can we please do a roll call vote?
Assemblywoman Benitez Thompson,
Yes.
Assemblywoman Black,
Yes.
Assemblywoman Gorlow,
Yes.
Assemblyman Hafen,
No.
Assemblywoman Krasner,
Yes.
Assemblyman Matthews,
Yes.
Assemblyman Ornlicker,
Yes.
Assemblywoman Peters,
Yes.
Assemblywoman Summers Armstrong,
Yes.
Assemblywoman Thomas,
Yes.
Assemblywoman Titus,
Yes.
Chair Nguyen.
Yes, and that motion passes, and I will assign that floor statement to Assemblyman Ornlicker. And with that, we will go to our final bill on the work session document, which is Assembly Bill 138. Mr. Ashton, can you please summarize the bill and its amendments?
Thank you so much, Chair Nguyen. Assembly Bill 138 was heard by this committee on February 24th. It revises provisions governing eligibility for assistance through the Temporary Assistance for Needy Families Program, TANF, or the Supplemental Nutrition Assistance Program, SNAP, for persons who have been convicted of certain drug-related offenses. And Assemblywoman Martinez proposes the following amendments to the bill. Amendment 1, revise the bill to allow a person who has been convicted of a felony drug offenses to be eligible for TANF and SNAP benefits in the state, regardless of whether the person demonstrates he or she is participating in or has successfully completed a treatment program, has not possessed, used, or distributed controlled substances since beginning any such treatment program, or is pregnant. Amendment 2 adds also certain co-sponsors to the bill. Madam Chair?
Thank you. Do I have any comments or do I have any questions, I'm sorry, from the committee on this bill?
Madam Chair?
Go ahead, Assemblywoman Titus.
Unfortunately, I think, although I support the intention of this bill and access to food and not having folks go hungry, the amendment is the part that I am not supportive of. Therefore, I will be a no on this bill.
Thank you, Assemblywoman Titus. Do I have any other questions from the committee regarding this bill? Seeing none, I'd entertain a motion at this time.
So moved. Amended do pass.
I have a motion to amend and do pass by Vice Chair Peters. Do I have a second?
I'll
Looks like
second.
I have a second from Assemblywoman Benitez Thompson. And with that, Madam Secretary, can we go to a roll call vote?
Assemblywoman Benitez Thompson,
Yes.
Assemblywoman Black,
No.
Assemblywoman Gorlow,
Yes.
Assemblyman Hafen,
No.
Assemblywoman Krasner,
No.
Assemblyman Matthews,
No.
Assemblyman Ornlicker,
Yes.
Assemblywoman Peters,
Yes.
Assemblywoman Summers Armstrong,
Yes.
Assemblywoman Thomas,
Yes.
Assemblywoman Titus,
No.
Chair Nguyen.
Yes, and that motion passes, and I will assign that floor statement to Assemblywoman Martinez. And with that, one second. I know that one of our assembly members on the previous bill, I think it was Assembly Bill 191, had miscast his vote on that one. And I don't know if he just feels comfortable like changing his vote when it ultimately hits the floor. Otherwise, we would have to redo the vote. So I'm going to kind of look at him and see if he wants me to redo the vote.
That's fine. I'll clarify it on the floor. Thank you, Madam Chair.
Okay, no problem. Thank you about that. I know that sometimes that happens. It did pass, so you will have the opportunity to correct your, incorrect vote here in committee. So with that, unless Mr. Ashton tells me otherwise, it looks like that concludes the work session. So I'm going to move on to our 3 bill hearings that we have this afternoon. I have allocated equal time for testimony in support, opposition, and neutral after the bill introduction. And with that, I will open the hearing on Assembly Bill 228. This bill establishes provisions related to children's advocacy centers. Assemblywoman Miller, please begin when you are ready.
Thank you so much, Chair Nguyen and members of the committee. For the record, I am Brittany Miller, representing Assembly District 5. I'm here today to present for your consideration, Assembly Bill 228, which proposes a new child-friendly approach to addressing an unfortunate and pervasive issue in our society, child maltreatment. Between July 2019 and June 2020, Child Protective Services investigated nearly 14,300 cases of potential harm or risk of harm inflicted on children in Nevada. About 3,100 investigations were substantiated, meaning evidence of abuse or neglect were found. For a child, experiencing abuse and neglect is traumatic. It can cause lifelong harm to children, their families, and communities. Many children who experience maltreatment are then pulled into a system that requires them to relive this trauma over and over as they share their story with law enforcement, child protective services, caseworkers, lawyers, investigators, and judges. Children deserve to grow up safe and healthy. As a teacher, on a daily basis, I see how the policies, systems, supports, and individuals that surround them influence their lives. As legislators, we have the ability to create policies and systems to protect and support vulnerable youth who cannot protect or speak up for themselves. Assembly Bill 228 takes a step in the right direction by providing children who have experienced abuse or neglect a safe, child-focused environment to receive the services and support they need to address their trauma and begin the healing process. Specifically, the bill requires state and county child welfare agencies to ensure children who are the victims of abuse or neglect have access to a multidisciplinary team through children's advocacy centers. According to the National Children's Alliance, children's advocacy centers provide safety, security, and a wide range of services for children and families who are the victims of abuse or neglect. Generally, centers are community-based and staff provides direct services to children in need. Children's advocacy centers uses multidisciplinary teams that include professionals with backgrounds in criminal justice, law enforcement, child protective services, mental health, and medical and victim advocacy to investigate maltreatment, hold offenders accountable, and most importantly, help children heal from the trauma of abuse or neglect. I was delighted to sponsor this legislation and so honored to be asked to do so. Madam Chair, I will now turn it over to the experts led by Mr. Jesse Haw, who will discuss the specifics of the bill, introduce the rest of his co-presenters, and provide additional background information. And of course, at the conclusion of their remarks, we are available to answer any questions you may have.
Thank you. I just remind your co-presenters providing expert testimony to make sure that every time that you get on that you clearly state your name for the record, just to make things easier for our committee secretary. Thank you. And with that, I'll turn it over to you guys.
Thank you. Hi, I'm so excited to be here. My name is Jesse Haw. Last name is H-A-W. For the record, I'm chair of the Legislative Task Force for the CACs of Nevada. Thank you, Chair Wynn, for hearing us today, and also Assemblywoman Miller for sponsoring this bill, and everybody serving on the committee. I realize the time and effort you put into what you do and the service for our state, so I sincerely appreciate that. We'd like to start the meeting, or our presentation, I should say, with Cheryl Cooney down from Las Vegas. Cheryl, can you jump on?
I can. For the record, this is Cheryl Cooley, and I am serving as the chair for the Children's Advocacy Centers of Nevada. I hail from Assembly District 17, so it's great to see representation on this committee for my district. And I wanted to explain the difference between having a multidisciplinary approach versus how things used to be. So let's say a child was at school and shared with their best friend the big family secret, especially when it comes to sex abuse. And say the best friend will go to the teacher, and the teacher will come back and ask little Johnny what it was that he told. And then the teacher gets the principal to come ask Johnny what was told. And then the principal gets the detective. And then the detective gets the social worker. And then the social worker gets the doctor. And before you know it, a child has told the best kept secret that they have to a plethora of professionals, all well intending, but each time you relive that, the trauma just continues to build up. And so what happens is, what has happened with the children's advocacy movement nationwide is we provide a one-stop shop so that when Johnny comes to the CAC, we have a team of forensic interviewers, and that is a research-based, non-leading way to interview children. That way, children are telling the story in their own words and from their own perspective. And based on what that child says in the forensic interview, law enforcement is able to go off and seek justice. CPS is able to go off and make sure that children are safe. The medical staff is able to make sure that the child is all right, that they're okay. We have family advocates that are able to help with the victims of crime money so that we can get the counseling that needs to happen. And CPS, did I say already, for safety? But it is really the best way and the best approach so that a child is not traumatized again and again and again, but they can tell their story. And we, from that one story, are able to go off and seek justice for children. One of the things that has been amazing is to see how that plays out long term. And even if you are able to affect one life, that is an amazing thing. So we'd like to play a video for you of a young woman who came to the CAC when she was much younger. And just to see the positivity that can happen when we all come together to save a life.
Broadcast services, it looks like we're having some audio issues. At least I don't know if anyone else can hear it. It doesn't sound like it.
Hello, this is Broadcast. If you could close out of your screen share, when you go to add the screen share again, there will be a little box in the lower left.
And I'm 20 years old.
Thank you. That is coming in clearly.
So the abuse started when I was 6 years old, and it basically ended when I was 14 years old. I was sexually abused by a family member, and it wasn't just a one-time occurrence. It was every day, multiple times a day. At that point of my life, it was a part of my daily routine. it was the normal for me. And that was the weird thing, was I thought that being sexually abused was a normal thing that happened to everyone. The abuse finally came out after one, I believe it was my first suicide attempt. I was forced to go to therapy after every person is, after they try killing themselves for the first time. And it was on the second session, and my therapist kept stressing, whatever you say is confidential. Don't worry, it's confidential, it's confidential, it's confidential. So I finally told her about the abuse, and I told her that a family member had been sexually abusing me from as long as I could remember. And of course, she had to tell someone. She couldn't just sit with the fact that I was being abused and still was currently being abused. So that's when the abuse came out. I was waiting for CPS and for someone to get involved. I knew that that was the next thing that was going to happen. And so I got led to the office, and my social worker, who at the time wasn't yet my social worker, was there. And she asked me, did I know why she was there? And I was like, I do. So I found my way to the SNCAC. Physically going there, it was very terrifying and very traumatizing, because at that time, I believed that the abuse was my fault. And I felt extremely embarrassed that I was being sexually abused. Like it had something to do with my morals or my demeanor, and that's why I was being abused. So actually going there was terrifying because I felt like I did something wrong. But the staff members there were so sweet and so caring, and they just wanted to make sure that I was comfortable and that I knew that I was safe. They were fantastic. I remember after we did the interview with the detectives about what was happening while I was there, and like went into the details of the abuse, I was bawling my eyes out, and the detective leaned down and went on eye level with me. She was like, this isn't your fault. No matter what happens, when anybody says, this is not your fault, and I believe you. And those were the most reassuring words that I've ever heard. When a kid's family doesn't believe them when they tell them that they're being abused, it's the most devastating thing ever. Because family's supposed to be there for you. They're supposed to love you unconditionally, and they're supposed to want the best for you to keep you safe. So when they don't believe you when you say you're being abused, it's the worst feeling. You feel so deflated. Like this, it took so much courage to tell them what was happening, and then they just throw it back in your face, saying that it didn't happen or wasn't as bad as you thought, or taking the other person's side. So my advice is keep finding someone who's going to listen, because there's someone out there that is going to listen and is going to care and who's going to take the right actions to make sure that you're safe and that you get the help you need. Getting better isn't just an automatic thing. It's not something that's just going to happen because you exist. You need to work towards getting better. And if that means going to therapy, sometimes going to therapy 3 times a week, along with group sessions until you know you can do it. Sometimes that means going on medication if you need it. It's self-love, it's self-care, it's allowing yourself to make mistakes and to be able to forgive yourself for things that you don't have to forgive yourself for because it wasn't your fault. But if you work at it, you will get better, and soon you won't have to work at loving yourself, because loving yourself comes naturally and easily like it should.
So the next person that is presenting is Peg.
Yes.
From Washoe.
Hi, good afternoon. My name is Peg Samples. I currently serve as the Chief Deputy District Attorney over our Crimes Against Children team at the Washoe County District Attorney's Office. I have been a prosecutor in both Clark and Washoe counties since 2006. I was very fortunate to be a founding member of the Washoe County Children's Advocacy Center back in 2014. I'm very lucky because I've been in the unique position to prosecute cases involving child victims, both before and after the inception or introduction of child advocacy centers here in Nevada. I am very, very proud of the work our CACs are doing, not just to hold offenders accountable, but to treat every victim of child abuse by offering a child-friendly environment where the child only has to tell his or her story one time, and they have immediate access through the CAC to victim advocates, to therapists, to medical treatment, and to numerous community resources. We have seen a tremendous benefit to our victims by offering them free therapy, advocacy, even things like community housing and things like that. So we aim to stop the cycle of abuse that many of these victims find themselves in. I'm very happy to be presenting AB 228 today, and I'm happy to answer any questions or address any concerns that you may have. And I believe
always good to see you.
Thank you. Next up is Ms. McKenna.
Good afternoon, Chairwoman Wynn, Assemblywoman Miller, and committee members. My name is Kathy Mckenna, and I'm the Executive Director for the Nye County Children's Advocacy Center with offices in both Pahrump and Tonopah. In 2020, our CAC served over 175 children in our community who had been physically and/or sexually abused. I believe all Nevada families should have the ability to use an accredited CAC in their own community should their children be faced with such a tragedy. I'm in great support of AB 228, and I'm available to answer any questions you may have. Next up is Rachel.
Hello, my name is Rachel. I am the program coordinator and one of the forensic interviewers here at Great Basin Children's Advocacy Center in Elko, Nevada. We serve Elko County, Eureka County, Lander County, White Pine County, and Humboldt County at times. We also serve anybody else who might need our services. Our mission is to support, nurture, and protect children and families who are involved in child abuse investigation and treatment. We do this by providing a child-friendly environment that minimizes trauma and fosters healing. We are in support of Assembly Bill 228. If you have any questions, I'm here to answer them. Thank you.
Thank you so much. And now Dr. Joyner is going to join us.
Thank you. For the record, my name is Amber Joyner. It's great to see some of my old colleagues here from when I was the Assembly member for District 24 in Reno. It is such an honor to be back in a meeting of the Assembly Committee on Health and Human Services. The last time I was here, I was the vice chair of the committee where Assembly Member Peters is now. And because of that, I know the important work that you all do, and I'm extremely grateful to Chair Wynn for scheduling this bill for a hearing today, and to Assemblymember Miller for sponsoring it. I'm here today just representing myself as a strong supporter of the CACs in Nevada. I want to tell you a story of how I got involved with the CACs. When I was an Assembly member, like you all, I toured the CAC in Washoe County, and I was astounded by the incredible work that they were doing there. They make sure that kids who are victims of the most horrible abuse crimes have their cases handled correctly and in a child-friendly environment. And I was impressed by their highly skilled multidisciplinary teams, how they collaborated on cases, and how well they provided wraparound services to help the children and their families recover from these awful abuses. So after that tour, I believed so strongly in the CACs and the benefits that they provide to our kids that I wanted to help in any way I could. So I became a consultant with them, and I have attended 2 national conferences with the National Children's Alliance, which is the national organization that accredits these centers. At those meetings, I saw how much further along other states were in making sure that their kids all have access to the best practices used in the CACs. Defining legislation like AB 228 has passed in 34 other states. It is crucially important. I believe very strongly that Nevada's most vulnerable kids need these centers. AB 228 will enable the CACs to continue to thrive and to expand to serve more kids in Nevada. So I hope you will all support the CACs and the important work that they do by passing this legislation. And next, I'll pass it off to Jesse Ha. He'll specifically talk about the parts of the bill and some proposed amendments.
Thank you, Dr. Joyner. Okay, again, for the record, Jesse Ha, HAW, with the chair of the Legislative Task Force for the CACs in Nevada. First off, I want to apologize. We have a late amendment that just came in after working closely with Clark and Washoe County, as well as the Division of Child Family Services and DHHS. We have agreed to have 3 amendments, or proposed 3 amendments, which didn't get uploaded in time on Nellis, and so I apologize. I have sent it out to all the members of the committee. Chair Nguyen, I'm happy to screen share that if you would like to see that, or I could just walk through quickly those amendments before explaining the rest of our bill. Do you have a preference?
You know what, you can go ahead and just explain it. I know that it was sent out. If the members can check their email, I know it was sent out there, and it was also just posted on NELS as well.
Thank you, Chair Nguyen. For the record, Jesse Haw, HAW. Thank you. Okay, so first off, housekeeping on the amendments. There were 3 amendments that we would like to propose. One is 6.1b, which just adds a sentence at the end that says, to the extent the standards are allowed by law. So that's pretty clear. We don't want anybody to do anything illegal. 6.4 clarifies that not every case of abuse or neglect may be appropriate for the CAC, and that each jurisdiction can make that decision on their own and independently. Some of the language in the original draft might have been unintentionally misleading to say every child has to go to the CAC. There are certainly some circumstances where it's not necessary. And finally, there's going to be a new section to disclose or be clear on how information is shared and clarifies what information is shared with all MDT members to support the child's case. So I'm going to jump in, and I know time is critical for all of you, so I'm going to try to go as quickly as I can and explain what the original bill language was. Sections 2 through 5 define terms of a children's advocacy center, multidisciplinary team, and a provider of healthcare. And for brevity, you might hear me say CAC, which is Children's Advocacy Center, multidisciplinary team, MDT, and those acronyms are just to speed up the presentation. So CACs need legitimate legal status in statute in order to ensure quality services in Nevada and improve the competitiveness and eligibility for funding from state, federal, and private sources. As Dr. Joyner mentioned, at least 34 states have adopted defining legislation for CACs in their statutes. These terms will ensure that as new CACs come along, they're clear that they know what they are and how and what they're going to do. It also ensures that if grants or donations are made, only legitimate MDTs and CACs meet this definition of national standards to be eligible for funds. Section 6.1 discusses how a CAC is accredited to ensure it follows national best practices. Nevada needs to ensure quality services are provided to child abuse victims. Currently in Nevada, there is no requirement for centers claiming to help abused children meet any standards. Requiring standards will improve the health of the child and provide justice by ensuring that the best possible interview, MDT response, and evidence collection procedures are followed. This would not exclude any CACs that we know of currently operating in the state because the 4 CACs, 2 are already accredited and 2 are working on their accreditations. Section 6.2, I'd like to preface this by saying we have been working yesterday and today with the Nevada Justice Association, trying to work out some language, an amendment that they are comfortable with and we're comfortable with. We're not quite there yet, so we don't have any amendments to offer, but I wanted to disclose that we have been talking with them. So going on to section 6.2, this discusses how multidisciplinary members are immune from civil liability if they act in good faith. Members of the MDT are still obligated to follow rules of their professions. So for example, a police officer couldn't destroy evidence and claim immunity under this provision. Further, 6.2 does nothing to alter the constitutional obligations of a police officer or a prosecutor in a criminal case, including disclosure obligations and finding of good faith that is required to trigger the statutory immunity. So actions that are intentional or grossly negligent would not be included. Nevada currently provides immunity to people in participating investigations and mandatory and voluntary reporters, but there is not the same protection for CAC employees and members of the MDT serving children at the CACs. They deserve the same personal protections that teachers and other mandatory reporters have. 6.3 is about confidentiality. A forensic interview, an electronic recording of that interview, or any transcription of that forensic interview conducted by a CAC should be confidential and exempt from public inspection and copying to protect families. Such recordings or transcriptions should only be viewed by court, attorneys, and investigators or experts for the purpose of judicial and administrative hearings. They should not otherwise be published, displayed, or disseminated by a person who is not party to the proceedings, except pursuant to a protective court order. 6.4 encourages access to CACs for all kids who need them. within availability of funds. It's really important to say that this is not a mandate on counties that you have to do a CAC. And it's included because in an ideal world, every child who experiences abuse or neglect would have access to a CAC. The capacity of Nevada's current CACs are likely to be overrun soon because as we're a growing state, you're going to have more needs, both rural and in the urban areas. Finally, Section 7 creates an account in the general fund for the CAC Center, for the Children's Advocacy Centers of Nevada, for the purpose of receiving gifts, grants, bequests, appropriations, or donations to the state CACs. The Division of Child and Family Services in Nevada's DHHS will administer the account. Lastly, just a few numbers. If the national figures are right, and 1 out of every 4 girls and 1 out of every 6 boys will be victims of sexual abuse by the time they're 18, then there will be over 100,000 Nevada children who will be victims. COVID could have exacerbated this issue, and that's still unclear. We're still wrestling with what the effects of COVID have had. But the most important number today is 12, and that's how many members are on your committee. You have the power to help these children. Please vote yes on AB 228. That concludes our presentation today. We're obviously here and open for questions and at the committee's disposal. Thank you.
Thank you. And with that, I have a couple of questions up on deck. And I will start with Assemblywoman Thomas.
Thank you, Madam Chair. And thank you so much, Assemblywoman Miller, for bringing this bill forward. This means so much to so many people. And thank you all of the stakeholders that have gathered to support AB 228. My question actually, because I'm so concerned, I'm actually floored that Nevada was not one of 34 states that had accreditation. And this is the year 2021. And, my daytime job is working in the district attorney's office in Clark County. And we see so many victims, and it hurts my heart when I see little ones that are in the DA's office prepping for to testify about this horrendous thing that has happened to them in their little lives. And I guess my question is more of the fact that what are the surrounding states that are accredited that we know about in our hemisphere? Is it California, Utah, Arizona, and did you confer with these other states to see how they were accredited? I guess that's my question.
I'm willing to jump in, or Jesse.
Dr. Joyner, can you jump on and answer that?
Sure. I'm sorry. I believe my testimony may not have been clear enough since I'm the one who mentioned the 34 states. We actually, the CACs in Nevada, the 2 largest ones in Washoe County and Clark County are accredited, in fact, nationally accredited. And our other 2 in Nye County and Great Basin and Elko are both striving towards accreditation. So they are also acknowledged by the national organization. So what I wasn't clear about is that those 34 states have passed statutory language to legitimize the CACs in statute and to provide the legal framework for CACs to thrive in their state. And we are not one of those states yet that has put them in statute. I'm sorry if that wasn't clear.
Thank you. I appreciate that. Thank you.
Thank you. And next we have up on my list here, Assemblywoman Benitez Thompson.
Thank you so much for the question, Chair Wynn. I think because so many of the questions I had, it sounds like are discussions that are happening in the amendment. And so I guess, are you comfortable with kind of some of the those conversations on the amendment, or otherwise I can just, whenever you want to have a conversation about the amendment, I guess that's where I have, those were my questions are kind of laced in there.
That's fine. If you want to go ahead and ask your questions, I think those amendment language is out there, so that's fine.
Okay. So I guess starting with the section 6 sub 1, so it sounds like on the section 6 sub B, that the goal is to make sure that it says as allowable by law, but we mean Nevada law. So we just want to make sure that if the National Children's Alliance have standards that far supersede Nevada law, that we understand that the base would be Nevada law. Is that right?
Yes, Assemblywoman, but for the record, Jesse Hogg. But yes, for the record, that is my understanding. That came specifically from Clark County, and I didn't ask that, but I assume the same thing you just did.
Okay. And then,
and I know that they are likely, Clark County is likely on the call to testify. So maybe if they can answer that question, that would be helpful.
Okay. And then in the, still in subsection 6 down to 4 on the changing the child welfare services shall ensure that children who are victims go into this. So I imagine then, will it be more like a referral process then coming from the child welfare agencies to the advocacy centers?
Assemblywoman Benitez Thompson, through the chair, this is Jesse Hogg, and it had more to do with they didn't feel like it should say shall, because not every case, for example, not every case of abuse and neglect may be appropriate for referral to a CAC. For example, they might not need a forensic interview or involve law enforcement or involve a significant trauma. So it was just more of a clarification of these agencies didn't have to all of a sudden send every single case over there when they clearly knew from the beginning that it wasn't something that needed to go to a CAC.
Okay, thanks. So right now the process with the CACs, is it a referral process, or is everything I guess I don't understand, I'm not savvy as to kind of what happens right now, the flow in that transition or that warm handoff?
Assemblywoman Benitez Thompson, Jesse Hoff for the record, again through the chair. I'd like to have Peg Samples answer that question. Peg, if you're still on, I'm not an expert either. So Peg, can you help us?
Yes, of course. Thank you for the question, Assemblyman Benitez Thompson. This is Peg Samples for the record. We do work off of a referral system now. So whoever takes the child's initial disclosure can report that to law enforcement or to CPS, and then they have channels to arrange for the case to be handled by the children's advocacy centers.
Okay, thank you. I appreciate that. And then you guys I had some questions kind of specifically about in subsection 6 sub 3, the references to the other 432B chapters. So it sounds like you're talking about confidentiality, that your goal is to get language that restricts confidentiality to a child's multidisciplined team so they can talk within each other. But it sounds like you kind of do want an official firewall from the work you do and the information you have from the child welfare agency or that kind of formal court and all those other systems. Is that right?
If I could respond to that one, I think in the goals of confidentiality, obviously, as stated by the, and this is Brittany Miller for the record, as stated in the video that we saw and addressed prior, the whole goal of the program is to not require the child or youth to have to repeat the same story multiple times. But in this confidentiality, we're referring to, this was something that was brought up by the public defender's office. And so sometimes if in a case, they may need to, and the same, both sides on the legal spectrum, may need to have access to that. So with a court order within the law that they could get access to it. So it's not so much, we definitely want that confidentiality to stay in there to protect the victim, but still having that availability for if, what is said, what is revealed needs to become part of that court case.
Thank you. Assemblywoman Denise Thompson, do you have any follow-up?
Little bit about that too. I think I wasn't so much thinking about the inclusion of subsection 6 in out of NRS 239. I think I was what the way I was interpreting this is looking, it seemed like that there seemed to want to be, and I didn't know, some maintenance of information by the ACA, and then what was maintained, information that was maintained and held by the child welfare agencies, but if it is just the exact same protections from public records, then they can set me straight there too.
Mr. Hall?
And we have Joanna Jacob on that's going to testify. If you wouldn't mind, Assemblywoman Assemblywoman Benitez Thompson, can we ask her to answer that when she comes on?
Yeah, that's fine. Thank you so much. Thank you for your time.
Any other questions? Assemblywoman Benitez Thompson?
No, thank you.
Okay, wonderful. We will go next to Assemblywoman Titus.
Thank you, Madam Chair, and thank you all to the presenters and folks bringing it through. Assemblywoman Miller, I think this is an important piece of legislation. I do have a question, however, and it is a little bit addressed under the amendment, and it relates to the bill itself under Section 6, number 4, that reads, to the extent that money is available, the governing body of each county and agency which provides child welfare services shall ensure that persons, and then you've eliminated the language, to ensure that children in general, you've eliminated who are victims of abuse, neglect, so that all children have access to a service available through the local advocacy center in accordance with any criteria by each county. So I'm wondering if number one, the children advocacy centers have resources for anything that a child would need, my first question. And number two, with the word shall in there, make available depending on money, who is going to determine how much money that would be made available, and then they would have to do something? I'm always concerned you don't have a fiscal note on here. I want to make sure it's not an unfunded mandate. I understand that you're trying to be, if they can afford to do it, et cetera. But when a word shall is in there to the extent that money is available, does that mean if they have a surplus of $100,000, if they have a surplus of $200,000? I just need some clarification on the effect to the county governments, especially say the rural counties who may not have this available. And what services then would have to be covered since you're taking out the victims of abuse. So that means, does a pediatrician have to be available? What services are we going to be required to do depending on the money, and who's going to determine the money?
Assemblywoman Titus, Jesse Haw for the record. I'll try to answer that with the intent is not to say every county shall do something. It is up to the county, and it's too hard, frankly, to dictate that when some counties are smaller and some are bigger and some have more money and some have less. And I'll give you an example of Washoe County. So Washoe County CAC right now, we see children from a multiple of counties, adjacent counties, who simply don't have the nexus to put something like that together. And then, and including even children over state lines, we will see anybody that we can, or that shows up. So the intent and hopefully the clarification of subsection 6, section 6, subsection 4 is not to make a county do something, because it raises all those questions that you just asked, right? And so the intent is when it's time and that county has decided, or that municipality has decided that they're going to do a CAC, here's the protocol to follow, here's the accreditation to follow, and this is the best practices. So it's really nuanced, because there's so many gray areas when covering things just like you mentioned.
Thank you for that follow-up, Madam Chair.
Go ahead.
I just want to make sure what the legislative intent is. Again, I think it's necessary. I think it's important. I think it's critical. But again, unintended consequences of bills, it's important to know what the legislative intent is, what you're trying to solve, and who's going to be held accountable for that when monies are available. So thank you for that clarification. Thank you, Madam Chair.
No problem. And I have my final question from Assemblywoman Michelle Gorlow.
Thank you, Chair Wynn. And I was just wondering if you could briefly describe what the accreditation standards are, and if it is a long list, then maybe just provide it to our secretary to distribute.
Jesse Haw for the record. Peg, do you have a handle on how that's handled?
Yes, Peg Samples for the record. Thank you for the question. The accreditation standards are actually published by the National Children's Alliance. It's fairly exhaustive just because it covers every individual portion of the MDT. So there are different standards, for example, for prosecutors in our training versus social workers in their training, their continuing training, things like that. And so if you just go onto the National Children's Alliance website, it does list them. I believe they're like 40 pages though, so we didn't provide them today.
Thank you. I appreciate you being in mind that 40 pages.
And Ms. Samples, if you do have that 40-page document, if you could provide it to the committee staff, and then we will be able to distribute that to the committee members to review.
Sure.
Okay, and with that, I will.
Chair, you're muted.
Of course I'm muted. And at this point, we will hear testimony in support, opposition, and neutral of Assembly Bill 228. At this time, Broadcast Services, can we go to our first caller in support of Assembly Bill 228? Again, I would remind our speakers to clearly state and spell your name and limit your testimony to 2 minutes. Again, you do have the opportunity to supplement any testimony in writing, and we have no problem with saying me too, yes, I agree, ditto, I support, and to get that as a part of the record. So with that, Broadcast Services, if we can begin support testimony, and I will note it is 2:38 or 2:36.
To testify in support of Assembly Bill 228, please press star 9 now to take your place in the queue. With the caller with the last 3 digits, 389, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair Wynn, Vice Chair Peters, and members of the committee. My name is Jennifer Noble, Jennifer Noble, and I am testifying today on behalf of the 17 elected district attorneys that make up the Nevada District Attorneys Association. We are in full support of Assembly Bill 228. CAC teens are there for our smallest, most vulnerable victims at one of the most stressful times in their young lives. They ensure children can speak out about what happened to them in a child-centered setting, with investigators specifically trained to interview children and professionals available to provide resources for medical and psychological support. AB 228 will ensure that entities identifying themselves as CACs follow nationally recognized best practices, which minimize trauma for children while ensuring full and fair investigations and benefit both the prosecution and the accused. We urge your support on this important legislation. Thank you.
Thank you. Broadcast Services, if we go to the next caller in support.
With the caller with the last 3 digits, 196, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair Wynn and members of the committee. I'm Eric Spratley, ERIC-SPRATLEY. I'm the Executive Director of the Nevada Sheriffs and Chiefs Association, and we're here in support of Assembly Bill 228 and appreciate Assemblywoman Miller bringing this important bill today. We do believe that the Children's Advocacy Centers are essential to the health, safety, and well-being of children in Nevada who are victims of child abuse and neglect. We support good legislation that helps children, and this bill does that. We thank this committee for considering AB 228. Thank you, Chair Wynn.
Thank you, Mr. Spratley. If we can go to our next caller in support.
With a caller with the last 3 digits, 229, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair and Committee. I'm Jamie Rodriguez. That's spelled JamieRodriguez. I'm the Government Affairs Manager for Washoe County, and
want to state my support for the bill along with the amendments from Clark County. Washoe County CAC was established in 2014 and immediately began working on accreditation. We were the first accredited CAC in Nevada, and we are very proud of the program that allows children who have had traumatic experiences to have to tell that story and relive that trauma as few times as is possible. We have, as mentioned previously, we have opened our facility to allow other entities, including counties or tribes in our area, to use our facility because we think it's really what's best for the children. Again, appreciate the sponsor working with us on the two amendments submitted by Clark County that we are supportive of. We do support the bill and any effort to strengthen this program. And just want to quickly mention that, as mentioned by former Assemblywoman Joyner, when it's appropriate, given COVID, if there's any members of this committee who would like to tour our CAC, I'm happy to arrange that and show you the facility, the work that's been done in our facility, and efforts to help children feel more comfortable as they have to go through this process of explaining their abuses. Thank you very much.
Thank you for sharing, and we can go to our next caller in support.
Caller with the last three digits, 688. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chairwoman and members of the committee. My name is Cole McBride. That's COLEMCBRIDE. I'm currently the program manager at the Washoe County Child Advocacy Center. I'm also the chair of the state chapter project, which is pushing to have all CACs in Nevada using the same national case management database so we can more effectively analyze our trends on a statewide level and determine where we can improve services. I've been fortunate enough to see the response to child abuse at the CAC in Washoe County. I've seen when the MDT comes together, and it never ceases to amaze me and impress me how much better we can serve these children and the families when we can provide really complete wraparound services using all of our disciplines together. I am very much in support of AB 228, and I'm available for any questions. Thank you.
Thank you for providing your testimony and support. If we can go to our next caller in support.
The caller with the last three digits, 739. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair Nguyen, members of the committee, Joanna Jacob, JOANNA-JACOB, Government Affairs Manager for Clark County. Chair Nguyen, I'm going to try and use my 2 minutes to respond to some of the questions that were raised. But first, I would like to thank Assemblywoman Miller, Mr. Haw, Dr. Joyner, and the state, actually, and Washoe County. We worked diligently on the amendments, as Mr. Haw stated, through the night and this morning to try and get something together for you. All of the child welfare agencies and counties worked together on that, and we thank them for working with us under these short time frames. Clark County's Children's Advocacy Center has been in place for over 20 years. To Assemblywoman Thomas, we are accredited, and recently we went through a year-long reaccreditation process and got the highest rating possible. So that is a point of pride for Clark County. It's akin to the Good Housekeeping sale of approval, for best practices for children suffering from sexual abuse. If that kind of lets you know what we're looking at, and I know that they're going to send those standards to you. Nevada law, there was a question about that amendment. Yes, that was our amendment from Clark County, and to Assembly Majority Leader Benitez Thompson, that was our intent to try and just clarify that to the extent that standards conflict with Nevada law, or to the extent things that are coming down from child welfare from the national level, it's a rapidly evolving field, which I think you'll hear me testify to several times this session. So we want to just make sure that there are no conflicts. And I believe the question about the confidentiality, I'm apologize, I missed that one. So I'm happy to clarify that. We worked on the confidentiality provisions with our district attorneys and with Mr. Armstrong. I know he is also going to be testifying. I think the intent behind that, from what I know of those discussions, is that we want to make sure that there is permission to share without criminal liability and proactive permission for a child welfare agency. The key is we have a multidisciplinary team working on this. I apologize, I'm going over 2 minutes. I know I'm trying to address the questions.
It's okay, Ms. Jacobs. I know that
okay.
I'm sorry. Go ahead and answer the questions. I know that we put you on the spot, so
okay.
I'll give you a little leeway
Very quickly.
in our committee members' questions.
Yes, I appreciate that, Chair. Thank you very much. Our partnerships, our team, just to put this in context, in Clark County includes Clark County Family Services, the DA's office, our Metro Police, Henderson Police, North Las Vegas Police, Boulder City Police, Mesquite Police, at times the FBI, and even the Air Force Office of Special Investigations. We have a lot of people coming together to partner on this process. So it was really, and when we set to the amendment, when we said we tried to address Assemblywoman Titus, that concern that you raised on maybe some overbroad section. When it came out of drafting, the bill sponsor, Assemblywoman Miller, we were all on the kind of the same page. We want to just make sure that we align with the standards. The standards require us to set protocols for referral to the Children's Advocacy Center, and they have to be reviewed by this multidisciplinary team and kind of updated from time to time, and that's what we were trying to incorporate there. The language, to extent funding available, we did try to address that because we were concerned we echoed your concern, maybe it was too broad, and I think that the amendment addresses our concern, and that's why we are in support. The final thing I'll say, Chair Nguyen, is I think we worked really hard on this. It's always a pleasure for me to testify to the good work that our Department of Family Services and everybody who helps us with the child welfare needs on behalf of really vulnerable populations in the state. It's always a pleasure for me to support legislation like this, which is going to help us to continue to do the good work that they do. So we are in support with the amendment. And again, I will also work with any committee member who would like more information or follow up with questions. Please use us as a resource. Thank you.
And thank you, Ms. Jacobs, and I appreciate you answering the members' questions. And again, I would encourage any members, if you have any follow-up questions regarding this, to contact the bill sponsor or follow up with Ms. Jacobs. And it's always good to have her back in HHS. I know in her previous role, she was in here a lot. So with that, if we can go to the next caller in support.
The caller with the last 3 digits, 611, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Madam Chair. This is John Piro from the Clark County Public Defender's Office, JOHNPIRO, testifying on behalf of both the Clark County Public Defender's Office and the Washoe County Public Defender's Office. And we are in support. We'd like to thank Assemblywoman Miller for addressing our concern at this point, which we believe is a conceptual amendment that will be accepted, regarding Section 6, Subsection 3, and the confidentiality issue. We are not seeking information carte blanche from the CACs. What we are seeking, though, is that should this information be involved in a pending case, that it be made available by a court order, only if a court orders it. Generally, when CPS records or something similar are done, they are only provided by a court order, and generally a court reviews them in camera before they turn them over to the parties, and that's all we're seeking there is the same type of treatment for any records created by the CAC. So we are in support, but if that amendment wasn't to be added in the future, we'd have to oppose, and we do not want to oppose this bill because it's such a good thing. Thank you.
Thank you, Mr. Piro. It sounds like Assemblywoman Miller had alluded to some of the provisions that you were talking about. So with that, we can go to the next caller in support.
The caller with the last 3 digits, 500, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Thank you, Madam Chair and members of the committee. For the record, Dan Morgan, CEO of the Builders Association of Northern Nevada. The Builders Association is proud to voice our support of AB 228. By adding the definition of Child Advocacy Center into the Nevada Revised Statute, you are providing the community the necessary resources to provide a child-friendly facility in which law enforcement, child protection, mental health, medical, and victim advocacy professionals work together to investigate and prosecute the abuse and help children heal from the abuse, and hold offenders and abusers accountable. It is critical that our community provide the protective advocacy, medical, and social services of a CAC to provide our children with the opportunity to heal and live a life without additional trauma or fear. The Builders Association and its members' goal is not only to develop and build lasting communities, but to support the safety and security of our population's most vulnerable, our children. Thank you to Assemblywoman Brittany Miller for bringing AB 228 forward, and a very special thanks to former Nevada State Senator and Builders Association past President Jesse Haw for his passion and continued effort in support of the Children's Advocacy Center and his commitment to our state's children. Thank you for your time today, and thank you very much for your service to our great state.
Thank you for your testimony. And at this time, it is 2:51. I've allotted 15 minutes of testimony in support of Assembly Bill 228. And at this time, I would like to turn and give equal amount of time to anyone in opposition to Assembly Bill 228. So broadcast services, if we can go. I know that there are potentially other people that are on the line to testify in support. And again, I would encourage you to please reach out. There are other avenues to express your support, whether that be in writing. I just want to make sure that we are able to fairly and equally hear testimony on all three bills that we are hearing today. So broadcast services, if we can go to any testimony in opposition of this bill.
To testify in opposition of Assembly Bill 228, please press star 9 now to to take your place in the queue. Chair, there are no callers in opposition.
And if we can see if there are anyone to testify in neutral.
To testify in neutral on Assembly Bill 228, please press star 9 now to take your place in the queue. Chair, there are no callers in neutral at this time.
I believe I have one person on the Zoom, potentially. Mr. Armstrong, are you testifying in neutral?
I am.
Go ahead.
Thank you, Chair. Ross Armstrong, ROSSARMSTRONG. I'm the administrator for the Division of Child and Family Services. And my first job in state service was actually as a special prosecutor for the Attorney General's office in rural Nevada, from Pahrump to Hawthorne, dealing with violent crimes, including sexual crimes against children, and assisted in standing up Nye County's Children's Advocacy Center. So I was glad to see the conversation today. To answer a few questions, I think specifically about the confidentiality provisions. The structure of child advocacy centers is different in each of our regions. And so in Clark County, it's operated by the Child Welfare Agency. In Washoe County, it's primarily operated by the District Attorney's Office. And in the rurals, we have nonprofits. There's been some interpretation in the past that a child welfare agency in the rurals could not share with a child advocacy center in the event the alleged perpetrator was not the parent. And so the confidentiality provision says we can share that information with the MDT in those particular situations. And so that is why you see the confidentiality provision, to make sure that there's as much information sharing among that team as possible. In state fiscal year 2020, I would note that we substantiated as a state 267 sexual abuse cases. That means 267 children sexually abused by the person legally responsible for them. So that does not include strangers or neighbors or some other acquaintance. It's the person legally responsible for them. I just want to applaud the work of the child advocacy centers. We operate other accounts like the account envisioned in this bill, and so we are happy to do so. It is not a huge administrative burden for us. And so I just wanted to make sure I answer those questions and let you know that this is not that the account is easy for us to manage, and I'm happy to answer any other questions.
Thank you, Mr. Armstrong, for your testimony. Broadcast services, I'm sorry, do we have anyone else in neutral on the line?
No, Chair, at this time we do not have anybody else in neutral.
Okay, at this time I will turn it back over to Assemblywoman Miller to make any closing remarks on Assembly Bill 228.
Thank you so much, Chair Nguyen. I would just like to thank everyone on the committee. I really appreciate your attention to listening to all the presenters and for all of the people that called in support. We understand that there's a few, we're still working on the language to get it to truly represent the intent, and happy that the stakeholders are coming to us with such great suggestions to strengthen it. I also would be remiss at the beginning, I didn't announce that Dr. Joyner, our former Assemblywoman, would be joining us, because from the last email, it was still, I was still a little uncertain, but I know that we always appreciate to see friendly faces in this building, in this space. So again, thank you so much. I know that it definitely sounds like there's support, especially from both sides of the district attorneys and public defenders, and from everyone that's in the space with helping and protecting children. So thank you so much.
Thank you. And with that, I will close the hearing on Assembly Bill 228. We are again going to jump around. And right now I will open the hearing on Assembly Bill 197, which revises provisions relating to persons experiencing homelessness. Assemblyman Watts, please begin when you are ready.
Thank you so much, Madam Chair and members of the committee. For the record, I am Howard Watts, representing Assembly District 15 in Central East Las Vegas in Clark County. With me today to present Assembly Bill 197 are Arash Ghafouri with the Nevada Partnership for Homeless Youth and Tavon Jenkins. Briefly, I'll just give a quick overview. Youth homelessness is a crisis in Nevada. On any given night, it's estimated that 312 youth aged 18 or under in our state are living on their own in shelters or on the streets. Over the 2018 to 2019 school year, school districts across our state identified 1,050 school-age, unaccompanied homeless youth. And the problem is as prevalent in our rural areas as it is in our urban communities, touching every corner of our state. AB 197 seeks to eliminate barriers that can prevent these unaccompanied homeless youth from accessing the critical healthcare services and documents that they need in order to exit homelessness. With that, I'd now like to turn it over to Arash and Tavon to explain why this issue is so important. Then I'll walk you through the bill and we'll stand for any questions that members of the committee may have.
Thank you, and I'll remind the speakers to please clearly state your name before you speak.
Thank you, Assemblyman Watts. And also thank you, Chairwoman Nguyen and members of the Assembly Committee on Health and Human Services for allowing me to be here today. For the record, my name is Arash Ghafouri, and I'm the Executive Director of Nevada Partnership for Homeless Youth. As Assemblyman Watts mentioned, youth homelessness is a very serious and significant problem here in Nevada. While every young person's story is unique, youth often experience homelessness on their own as a result of family instability, structural issues, and economic instability. Youth homelessness disproportionately affects some communities of youth more than others. Systems-involved youth, pregnant and parenting youth, LGBTQ+ youth, and youth of color are more likely to experience homelessness than their peers. Additionally, young people experiencing homelessness are also more likely to experience domestic violence and/or human trafficking. Due to the difficulties and complications of living on the streets or in shelters, histories of trauma, and limited access to resources, homeless young people experience higher rates of illness and injury, including malnutrition, dental disease, respiratory and infectious diseases, STIs, pregnancy, substance abuse, and increased future risk of diabetes and heart disease. Additionally, homeless youth experience significantly higher rates of mental illness. Homeless teenagers are 7.2 times more likely to attempt suicide than housed teenagers. Consequently, increasing access to healthcare for minors experiencing homelessness is paramount to the health of vulnerable young people and the wellness of our entire state. In my 10 years at Nevada Partnership for Homeless Youth, or NPHY, Southern Nevada's most comprehensive service provider for young people experiencing homelessness, I've seen countless young people present with health issues ranging from mild to severe. In order to ensure that young people can access the care they need, NPHY has partnered with many fantastic healthcare organizations, including Nevada Health Centers, the UNLV School of Nursing, the UNLV Dental Clinic, Southern Nevada Adult Mental Health, the Lions Kids Set USA Foundation, and others. However, many of our healthcare partners have faced barriers in providing services to unaccompanied homeless minors due to limiting and unclear language in Nevada law. Current law only allows medical providers to serve unaccompanied youth once they've been homeless for 4 months or more, and doesn't clearly explain how providers can determine which youth qualify. Accordingly, MPHY has worked with many healthcare providers who truly want to serve youth in need, but feel unsure about how to implement the current law correctly. AB 197 addresses this by establishing a simple and proven process to verify that a minor is covered by this law. The verification process proposed in this bill is modeled on federal financial aid process, which Nevada public schools, universities, and service providers have been utilizing since 2008. This same verification process is also utilized in a similar healthcare access law for minors in Maine, and in a California law helping minors access vital documents. AB 197 also allows unaccompanied homeless minors to access care right away when it's needed. This timing is extremely important, as a lack of immediate care can lead to routine problems becoming dangerous and even lead to death by suicide, overdose, or untreated illness in a population already prone to heightened health risks. Additionally, current law allows unaccompanied minors to access treatment from a physician or hospital. However, many of the providers who are available to provide care for our young people include nurses and nurse practitioners, physician's assistants, dental hygienists, and other licensed professionals who aren't clearly covered under the existing law. Furthermore, many of them people we serve have urgent and important healthcare needs that aren't appropriately met by physicians or hospitals, but rather they are appropriately met by behavioral, mental health, and dental health professionals. AB 197 also takes care of this, clarifying that unaccompanied minors can access not only healthcare services provided by a physician or hospital, but also mental and behavioral health, dental, and other critical services provided by all providers of healthcare, a category already defined in Nevada law. This will ensure that homeless youth can receive healthcare services that meet their varied needs. This bill will improve existing law and help youth access essential care, while strengthening the ability of organizations like MPHY and healthcare providers to meet young people's fundamental needs. Currently, 30 states allow unaccompanied youth to access basic health and behavioral health services without a parent. The American Academy of Pediatrics also supports these measures. This bill will simply clarify and fortify Nevada's existing law, ensuring that unaccompanied youth have access to basic health services.
I know I'm not alone in this. According to the Institute of Children, Poverty, and Homelessness, high school students who were homeless in the past 30 days had the highest rate of uncontrolled asthma, over 2 times higher than their peers. Due to not always having the ability to obtain my mom's consent, there have been times when I haven't been able to see a doctor or get my table, which is a scary and dangerous situation. When I was in MPHY's housing program, I was hospitalized with a life-threatening asthma attack. But luckily, I was already over the age of 18 and able to consent to all the health services I needed to recover. I was in MPHY's housing program for 3 years and am still very active in youth engagement, leadership development activities with MPHY. Accordingly, I've gotten to know a lot of young people experiencing homelessness over the years. Just recently, there have been youth who haven't been able to seek medical care for chest pains, who couldn't seek physical therapy after a gunshot wound to limit their mobility, and who couldn't get treatment for a serious mental health crisis due to them being unable to obtain parental consent in unaccompanied minors. I've also known of youth who couldn't access important preventive and other healthcare services offered by MPHY's partners, including dental clinics, physical health checkups, and screenings, and vision tests, because they couldn't consent to these services themselves as unaccompanied minors. This especially is important right now with COVID, as homeless minors have been turned away from COVID testing because they have been unable to obtain party consent, putting not only themselves, but other youth and staff and others at risk. AB 197 will make a huge difference for youth like me, allowing unaccompanied homeless minors to access the physical, mental, and behavioral health care that they need. I graduated from MPHY's housing program, and now I have a job in my own place, and I can tell you, it's difficult enough to try to navigate homelessness as a youth and to do everything you need to do to succeed in school, get a job, and eventually move into permanent housing. Having to do all of that with untreated health issues is almost impossible. By passing this bill, you can make sure unaccompanied minors can get the healthcare they need to survive, thrive, and build a better future for themselves and their communities. Thank you for your time.
Thank you, Mr. Jenkins. You did a wonderful job. I think this was your first time testifying or presenting here, so we really do appreciate you sharing your story. I know it's very personal and it's not always easy to relive that, but we do appreciate that. Assemblyman Watts, do you have anyone else presenting?
No, we don't have anyone else presenting, but I will walk you through the bill very quickly, if that's okay, and then we can open it up for questions.
Perfect, thank you.
Great. So going briefly through the bill, Section 1, Subsection 1, removes the requirement that a young person be homeless for 4 months before they can access health care without the consent of a parent or guardian, allowing unaccompanied homeless minors to access care as soon as those needs are identified. Subsection 2 assists healthcare providers in determining when this statute applies by establishing the clear and simple process that Mr. Ghafouri mentioned to verify when a minor is an unaccompanied homeless youth. As noted, this is tried and true from financial aid procedures and other processes, and it allows options such as written statements from service providers, from school homeless liaisons under the McKinney-Vento Act, or attorneys that represent the youth. Section 1, Subsection 3 clarifies that unaccompanied minors can access not only physical health care services provided by a physician or hospital, but also mental, behavioral health, dental, and other critical services currently defined in statute under the inclusive term providers of health care. This will ensure that homeless youth can receive the healthcare services that meet their varied needs, including preventative care. Subsection 4 of Section 1 makes conforming language changes and also clarifies that while a provider must ask for the minor's consent to communicate with parents or guardians, they cannot delay or deny care to the young person if the young person refuses that consent. Finally, Section 2 of the bill improves upon Assembly Bill 363 of the 2019 from the late Assemblyman Tyrone Thompson, and clarifies that people experiencing homelessness can get a fee waiver for birth certificates without the unnecessary barrier of having to access a notary public. With that concludes the walkthrough of the bill, and we'd be glad to answer any questions that the committee may have.
I think I have one question here on deck from Assemblywoman Titus.
Thank you. Thank you, Assemblyman Watts and the presenters for being here, especially the personal stories. Those, as the chair said, are always difficult to share, and we appreciate that you have shared that with us and given us your trust. So thank you for that. I have been in this building for my 4th session now, and many of my bills have worked to clarify what a provider is and add languages to include nurse practitioners and physician assistants. And I have personally been in the emergency room when a minor came in, and I was the ER doc, and I couldn't take care of them because unless it was a life-threatening condition, I could not take care of that person until we contacted a parent. So they literally sat there for hours. So this bill is important. My question on the bill, however, is on Section 1. When you go down Section 1, line, Section 1, number D, in there it says, is in a physician's judgment and danger from suffering a serious health hazard if healthcare is not provided. And I'm just wondering if that was an oversight, if you didn't want to take the opportunity to update the language there also, because we've been trying to go through all of our NRS and we're missing this languages to just remove the word just physician in that part. And I'm wondering if that was intent or just oversight.
Thank you for the question, Assemblywoman. Howard Watts for the record. The intent with the initial drafting of the bill was to specifically focus on the provisions related to accessing healthcare for homeless youth. So as you can see, there are some other provisions in Section 1, Subsection 1, B, C, and D. If it's the committee's interest in expanding the terminology from physician to cover other practitioners who could make those decisions, I think we would certainly be open to entertaining that. So it was not a deliberate omission. We simply left all of the rest of the statute alone if it wasn't specifically dealing with access to health care for homeless youth.
Well, if I might follow up on that, Madam Chair, thank you for that, Assemblyman Watts, but I'd hate to miss an opportunity to update the statute to what we see as providers in this day and age. And I think as now in the emergency room, we have many folks besides physicians, such as myself. We have now physician assistants and nurse practitioners in emergency rooms. And I think this is a good opportunity to kind of catch that when we see it and update the language. So thank you for that consideration.
Thank you. This is Assemblyman Watts again, and I appreciate that. And again, if it's the committee's will to make that adjustment, I think we're completely open to it. Also, I did forget to mention that Clark County is presenting an amendment. I'll let them speak to that during their supportive testimony, but we do consider that friendly. I just wanted to get that on the record.
Thank you, Assemblyman Watts. I think next up we have Assemblyman Ohrenlicker.
Thank you, Madam Chair, and thank you, Assemblyman Watts, for bringing forth this bill, which it's a great bill, and I'm supporting it. As with Assemblywoman Titus, I'd like to suggest an update in the part of the statute. That is on page 2 of the bill. We have the first page of the actual bill language, section 1, line 11, where it refers to one of the categories of eligibility as a mother or has born a child. That was written in 1975 before the Supreme Court fully developed its equal protection on mothers and fathers. And today the court would say you can't distinguish between mothers and fathers when it comes to raising children. So we should change that to parent. Thank you.
Thank you for the comment, Assemblyman Ohrenlicker. Howard Watts, for the record. Again, if it's the committee's will, we would gladly consider that amendment as well.
Thank you, Assemblyman Watts. I haven't received any messages, but I'm going to do a quick scan of the Zoom here. Do we have any other questions? Okay, I'm seeing none. So at this time, I'm going to go to Broadcast Services to begin testimony in support, opposition, and neutral of Assembly Bill 197. Again, I would remind everyone to clearly state your name, spell your name, and limit your testimony to 2 minutes. We will be timing to ensure everyone is given a fair opportunity to speak. And with that, it is 3:14. We will begin testimony in support of Assembly Bill 197. Broadcast Services, if we could have our first caller in the queue.
To testify in support of Assembly Bill 197, please press star 9 now to take your place in the queue. With the caller with the last 3 digits, 568, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, members of the committee. My name is Minnie Wood, MINNIEWOOD, and I thank you for the opportunity to speak in support of AB 197 today. I'm a nurse practitioner and I practice at a federally qualified health center called First Person Care Clinic in downtown Las Vegas, and I also teach at UNLV in the School of Nursing. I'm speaking for myself today. I support AB 197 because it reduces barriers for unaccompanied homeless minors to access the health care they need at the time they need it. In my time working with nursing students and clients of Nevada Partnership for Homeless Youth, I've encountered many homeless youth who couldn't access essential care when they need it due to restrictions in the law or healthcare providers' understanding of that law. No unaccompanied homeless minor should have to delay important care or screening for things like a tooth abscess, a suspected or confirmed sexually transmitted infection, COVID testing, or a mental health issue. Removing the barriers to getting adequate care through strengthening existing law, removing the 4-month wait, clarifying that youth can access all healthcare providers, and helping healthcare providers to implement the law correctly is an essential step in the right direction for the state of Nevada. I have seen too many healthcare providers refuse care to unaccompanied homeless youth for fear they would be violating the law. AB 197 makes the verification process more simple and aligned with other similar processes as for federal financial aid. As a nurse practitioner who works with vulnerable communities, I regularly see the results of patients having poor access to quality health care throughout their lives. As a nurse educator, I teach my students about population-level interventions that can improve health, not just for individuals, but for large groups of people and places. AB 197 is one such policy measure that can really make a difference for our community of unaccompanied homeless youth and the people who serve and maintain relationships with them. I hope you will join me in supporting AB 197, and thank you for your attention.
Thank you for your testimony and support. If we can go to our next caller.
The caller with the last three digits, 757, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Thank you. I'm Gwen Migita, M-I-G-I-T-A, Vice President at Caesars Entertainment over social and community impact. Excuse me. As a Asian Pacific Islander, I deeply feel the trauma and fear of home insecure youth. It tends to be a living hell for some who are lured into labor and sex trafficking and at best, daily survival for basic needs. Caesars Entertainment is supportive of AB 197. Credit goes to NPHY for working on this bill and arming me with your expertise to articulate the policy gap. Several years ago, I shout out to NPHY, Impact NV, Armand, this is Dr. Halle, St. Jude's Rents for Children, and the Asian Community Development Council to help Caesars develop a social impact blueprint for Southern Nevada. We looked at intersectional issues in trafficking, homelessness, and immigration integration. We identified root solutions such as mental health and a systemic long-term strategy to address the region's most pressing social issues. Caesars wanted to orchestrate a coalition-based strategy that would augment and not duplicate the good work of many service providers like the ones in the Policy Council on Homelessness. Today, Caesars co-chairs the first Nevada Resorts Corporate Social Responsibility Coalition, which represents members and suppliers to hospitality. We also invested deeply in need gap strategies and social equity work for Impact NV. Both groups prioritize homelessness as a key issue for collaboration. Caesars remains committed to playing a leadership role in supporting vulnerable populations. Last year, even through business closures and a merger, Caesars Foundation gifted over $1 million to communities in which we serve. This week, we're holding our first National Hero Employee Volunteer event in person in over a year. We're building thousands of wellness and homeless hygiene kits with LULAC, the League of Latin United American Citizens, Clean the World, and the National Black Law Enforcement Executives. Our Reno, Tahoe, and Las Vegas and Laughlin team members are participating in this effort. I'm optimistic that AB 197 will move forward to help us close a gap to better support Nevada's homeless youth. Thank you.
Thank you for your support. If we can go to our next caller and support.
With the caller with the last three digits, 739, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon again, Chair Nguyen, members of the committee, Joanna Jacob, Joanna-Jacob, Government Affairs Manager for Clark County. As Assemblyman Watts testified, we did put in an amendment to this bill, which is considered friendly, and want to thank Assemblyman Watts and Mr. Gaffori for their work with us on this bill. We are in support of this bill. Actually, one of my jobs at Clark County is to balance different departments and when we're taking positions on bills, and we actually do support this bill because we see a role here for us to work with the partnership, especially under the simplified procedure that has been set in place to allow us to help create the documentation for our social services. For example, if we have a youth who is homeless, to allow them to obtain this care. The purpose of our amendment is really just to kind of, from a technical perspective, recognize the circumstances under which a child welfare agency may be responsible for the legal custody and decision-making for medical care for a child who interacts with our system. They are not considered a guardian, they are not considered a parent, but rather a custodian at certain points in their interaction. And our purpose of our amendment was just for valid policy reasons. We understand why there should be a reduction in barriers to care. So just wanted to be treated on par with parents and legal guardians
in this bill. We support the reduction in barriers. We support this bill and the process that is put in place. It is very critical to us that we try to reduce those barriers and that we work with everybody in our community to connect vulnerable populations to care. And it's in that spirit that we are here in support with the amendment. We know that there is further support from Washoe County. They will also testify in support of this amendment. Thank you again to Assemblyman Watts and to Mr. Garfori, and thank you for the work that they do. And that concludes my testimony.
Thank you, Ms. Jacobs. If we can go to our next caller in support.
The caller with the last three digits, 690. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Thank you, Patricia Julianelle, Julianelle. Good afternoon, Madam Chair and members of the committee. I'm from Schoolhouse Connection, a national nonprofit organization. I've worked on state laws similar to AB 197 for a decade in a dozen states. Based on that experience, I feel very comfortable stating, quite simply, that AB 197 will save lives. That is not hyperbole. It also will help young people focus on their goals of education, employment, and independence, rather than having to expend tremendous amounts of energy on their most basic physical and mental health. Other speakers this afternoon have explained this far more eloquently than I can, so in the interest of brevity, I'll just state that from my national perspective, I simply would like to offer that Nevada's existing law took an important step forward to protect the health and safety of young people, and AB 197 improves it. It makes it clearer, easier for healthcare providers to implement, and easier for youth to be able to benefit from. Should this law pass, it will be a law that I will use as a model in my work in other states. So I applaud Assemblymember Watts for sponsoring this, and I hope this committee will support it, and I'm very grateful for the opportunity to speak. Thank you.
Thank you. If we can go to our next caller in support.
The caller with the last three digits, 237. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair members and Assemblyman Watts. Thank you for taking the time to hear my testimony. My name is Pamela Gergis, Pamelagirgis. I'm a pediatric nurse practitioner and the medical provider for Children's Health Fund and Nevada Health Center's mobile medical van that serves homeless, sex-trafficked, and refugee children and youth. Since 2018, our team has been providing free health care to homeless youth in partnership with Nevada Partnership for Homeless Youth. Many of the homeless youth we see on a weekly basis are unable to access health care services due to the restrictions and wait times on consent laws for homeless youth. I've seen many youth unable to access behavioral and mental health in particular. Many homeless youth have depression and multiple previous traumas. Restricting care increases the risk of suicide and potential harm to these youth. With current restrictions, youth are often not able to access specialty health care services either. Our team is seeing time and time again where this has negatively impacted many youth in need of medical services. An example of this is we recently had a recent homeless youth with uncontrolled diabetes. He was in desperate need of referral and care of endocrinology for an insulin pump and better titration of his insulin. Because of the 4-month rule, care was delayed and resulted in multiple hospitalizations for this youth, risking his life and resulting in him missing work and losing his job, setting him further back. On the contrary, by being able to provide essential health care services weekly to homeless youth, I've seen countless stories of success where basic health care services to treat asthma, depression, diabetes, and other health conditions has given our youth hope and a new lease on life. So I urge you to consider eliminating the 4-month wait period and broadening the language of who can provide care for homeless youth, and not under just emergency care basis. Your consideration action could mean life or death for the many homeless youth of Las Vegas. Thank you again for your time.
Thank you for your testimony. Do we have any other callers in support?
Yes, Chair. With the caller with the last three digits, 122, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair Nguyen, members of the committee. For the record, my name is Katie Ryan, Katieryan, and I'm System Director of Nevada Government Relations for Dignity Health St. Rose Dominican, and also a member of the Policy Council on Homelessness through the Nevada Homeless Alliance. I just wanted to briefly go on the record in support of AB 197 as an us too. And I also wanted to add that we're glad this oversight will hopefully be remedied by the passage of this bill, and wanted to thank the Nevada Partnership for Homeless Youth and Assemblyman Watts for advocating on this important issue. Thank you, and I'm available for any questions.
Thank you. Can we go to our next caller in support?
With the caller with the last three digits, 199, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair Wen and members of the Assembly Health and Human Services. My name is Tess Opferman, that's OPFERMAN, speaking on behalf of the Nevada Women's Lobby. We want to thank Assemblyman Watts for bringing forward this legislation. Homeless minors face high levels of injury, sexual exploitation, and more. It is critical that unaccompanied homeless youth have access to health care and services that will keep them safe and ultimately help keep them off the street and get stable housing and support. We urge your support and thank you for your time.
Thank you. If we can go to our next caller in support.
With the caller with the last three digits, 988, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Thank you, Chair Wynn and members of the committee for considering this important bill. My name is Emily Paulson, and I am the Executive Director of the Nevada Homeless Alliance and the Chair of the Policy Council on Homelessness, which is a cross-sector coalition that brings advocacy, nonprofits, business, and academic sectors together to advance policy solutions to end homelessness. We are in support of AB 197. One of our top policy focuses is to improve access and equity in services for people experiencing homelessness. Nevada has one of the highest rates of youth homelessness in the nation, and as you heard from Mr. Gathuri and Mr. Jenkins today, these youth are particularly vulnerable and in need of access to healthcare services, including behavioral health care. Under current Nevada law, the delays in care and access to services hurt youth during a critical window of time for young people in crisis. AB 197 is a simple and smart step to keep youth safe and healthy, and we urge you to support this legislation. Thank you.
Thank you. And I'm going to take one last caller in support. If we can go ahead.
With the caller with the last three digits, 229, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair Wayne Committee, Jamie Rodriguez, JAMIE. RODRIGUEZ. Again, Government Affairs Manager for Washoe County. Appreciate that you've got a whole nother bill to get to. So just want to reiterate that we are supportive of the bill, especially with the friendly amendments from Clark County, and appreciate the bill sponsor working on those concerns and accepting those as friendly amendments. Thank you so much.
Thank you. And at this time, I'm going to close testimony in support of Assembly Bill 197. I will note that I went for 15 minutes. If there are any additional callers that are on the line to testify in support, I would encourage you to submit your written documentation regarding that. And with that, we will go to testimony in opposition of Assembly Bill 197.
To testify in opposition of Assembly Bill 197, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Wonderful. Do we have any callers in neutral?
To testify in neutral of Assembly Bill 197, please press star 9 now to take your place in the queue. Caller with the last three digits, 384, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Madam Chairwoman Wynn and members of the committee. My name is Alexis Tucey, ALEXIS, last name TUCEY. I'm a Deputy Administrator with the Division of Child and Family Services, and I'm here to testify in neutral on AB 197. We appreciate the bill and the shared efforts to help transitional age youth and the homeless population, or the homeless youth population, and are thankful for the amendments that Clark County has submitted. We definitely appreciate that there are sometimes issues with the statutes and that it can be really unclear, and it's a little unique with our status as custodians. But again, just wanted to testify in neutral and express our appreciation to Clark County and for the bill itself. Thank you so much.
Thank you. Do we have any other testimony in neutral?
Chair, there are no more callers at this time.
Thank you. At this time, I will close testimony in neutral on Assembly Bill 197, and I would invite our sponsor, Assemblyman Watts, back up to make any closing remarks.
Thank you so much, Madam Chair, members of the committee. Again, Howard Watts for the record. Thank you for your consideration of this. As the others said in testifying and providing support, this bill really has the ability to save lives. It has the ability to build on what I believe has already been a strong record and commitment from our state and our legislature to remove barriers and assist homeless people, particularly homeless youth, in getting back on their feet. So appreciate all of the suggestions that were made to help strengthen this bill. And I ask you all for your support and thank you again for your time.
Thank you. And with that, I will close the hearing on Assembly Bill 197. And thank you guys for being so patient this afternoon. I know it's always hard to come back after an afternoon, a long afternoon like this, to pay attention. And so I appreciate that. And at this time, I will open the hearing on Assembly Bill 96 and welcome back again Assemblywoman Cohen. She is living in our committee and I love it. So this bill creates an Emergency Response Employees Mental Health Commission. And with this, I will turn it over to Assemblywoman Cohen to begin when she is ready.
Thank you, Chair, and thank you, committee. I think we can do this pretty briefly. For the record, I'm Leslie Cohen, representing Assembly District 29. I'm here today to present Assembly Bill 96 for your consideration. This bill came from my interest in peer support for first responders. I first became interested in the issue because I heard a radio news story about a program for peer support for first responders out of another state that just was having great success. And one of the people, and I remember this from years ago, one of the people being interviewed spoke about how most of us run away from fire or bullets. But first responders run to them. So when those people who run toward the fire and run toward the bullets, when they're in crisis, it's often easier for them to open up to people who know what that's like and what they go through in their daily lives and in their daily jobs. So, and to be clear, they do need to open up and get support. So according to a supplemental research bulletin from the Substance Abuse and Mental Health Services Administration of the U.S. Department of Health and Human Services, which was based on literature and scientific publications found through the National Center for Biotechnology Information and the United States National Library of Medicine, it's estimated that 30% of first responders develop behavioral health conditions, including but not limited to depression and post-traumatic stress disorder, or PTSD, which compares to 20% of this in the general population. And the bulletin referred to a study about suicidality, noting that firefighters were reported to have a higher attempt and ideation rates than the general population. And then according to several studies nationally, more than twice as many firefighters die from suicide than in the line of duty. According to a study by the Ruderman Foundation, both police and firefighters are more likely to die by suicide than in the line of duty. And moreover, that study noted that the Firefighter Behavioral Health Alliance estimates that firefighter suicides are substantially underreported. So first responders are at risk for PTSD, depression, substance abuse, and suicide ideation and attempts. And both natural and technological disasters were found to be associated with the increased risk of these conditions. And just so you know, I had to look this up myself. So a technological disaster is a catastrophic event that is caused by either human error in controlling technology or a malfunction of a technology system. And technology-based disasters are as serious as natural disasters. And examples include like bridge collapses, dam failures, industrial, maritime, and aviation accidents, and then more drawn out events resulting from breakdowns in technology in which highly toxic substances are used or stored. So on top of that, emergency medical service personnel, or EMS, are not immune to mental health issues. According to that bulletin that I was referencing, one of the core risk factors for first responders is the pace of their work. One study noted in the bulletin found that 69% of EMS professionals have never had enough time to recover between traumatic events. And this results in depression, stress, and PTSD, suicidal ideation, and other functional and relational conditions being reported. And if anyone is interested in seeing any of those reports or studies, I'm happy to provide them. So now the good news is that since I started to think about, gee, we should do something for first responders, their supporters, and mental health professionals have started doing something right here in Nevada. So I've substantially amended AB 96 so that we can help first responders while frankly not spending funds that we don't have. And moreover, this legislation will not counteract any of the good work done by first responder peer support groups, but hopefully we'll just be helping with that. So please refer to the conceptual amendment. And before we go through it, I just like to thank our policy and legal staff and Margot Chappell, the Deputy Administrator for Regulatory and Planning Services of the Division of Public and Behavioral Health, for working so hard to try to get this conceptual amendment done and come up with something that is going to be beneficial. And I'm sorry about the delay in getting the final conceptual amendment to you and to the stakeholders. The delay is my fault. But anyway, so moving forward with that conceptual amendment, what we're doing is taking out sections 1 through 12, and we're adding a section that's authorizing a governmental entity which licenses and regulates first responders to enter into contracts with nonprofit organizations to carry out programs to provide peer support counseling for first responders. So what they'll do in those agreements is basically promote peer support for first responders. And so what we're looking at is making sure that the nonprofit organization that is being contracted with is establishing and operating a toll-free hotline for first responders to call if such persons are experiencing mental health issues as a result of the nature of their work. And then also that they establish and maintain a network of peer support counselors to provide the peer support counseling to the people who call the toll-free hotline established and operated by the nonprofit. Also that they establish and maintain a website that provides information on mental health issues associated with emergency response work. And that is going to include, without limitation, stress, PTSD, addictive disorders, self-medication. And then also on the website, they're going to provide information concerning local and national support groups for mental health services. So to be clear, that would be the division will be doing that on their website. Then to the extent that it is financially feasible, the division is going to collect and report information relating to suicide or suicide attempts for first responders to the chief medical officer. So that's, a data issue, so that we'll have, data about how first responders are doing in Nevada. And so we'll see if we're making improvements and where we need to be looking and where we need to go. So once again with us is Margot Chappell. She's the Deputy Administrator for Regulatory and Planning Services of the Division of Public and Behavioral Health. Again, her office was extremely helpful in getting to this bill to a place where we wouldn't have a fiscal, but we could still do some help, some good for our first responders. And so she's here to answer any questions and provide information as needed. Before we take questions, certainly though, Deputy Administrator, if you'd like to say anything, I'd welcome that.
Thank you, Margot Chappell. For the record, that's MargotChappel. I am with the Division of Public and Behavioral Health, as the Assemblywoman said, and am definitely supportive of this language that we have now changed. so that we can provide support without the funding that is desperately needed. But at least there are agencies already doing this work, and this would lend them the support. And then it will also empower them to be able to seek grants and contracts to support their existing work and future work. Thank you.
Thank you for that, Leslie Cohen, Assembly District 29. With that, we're available for questions, Chair.
Haven't received any in my messages, but I'm just going to do a quick scan here of gallery view. If you have a question, can you please kind of wave your hand on Assembly Bill 96? I don't see any. See, you answered all of your questions, and I know that you have done so much work on that amendment, and it was very substantial. Oh, wait, it looks like we have one question. Assemblywoman Benitez Thompson, go ahead.
Thank you so much. Sorry, Madam Chairwoman. I was just trying to pull open the amendment on my screen, and I did, and I just think I lost it. Nope, I got it back. Okay, thank you so much. The question is just on the amendment then. So I'm just looking at the amendment, right? We're doing just a gut and replace.
Right.
So
Yes.
Okay. So then I guess I just want to make sure. So when I look at this and I see a government entity which license, so then we're just authorizing all of the local entities to set something like this up. Is that right?
Margot Chappell, for the record, it is. And part of what the Assemblywoman and I were chatting about was that the division only licenses of those first responders, the EMS providers. And so there are entities that do the certification, permitting, licensing of police officers and firefighters, and we don't do that. So this makes that flexibility, allows those other entities to do that work as well and engage in contracts and support the first responder support programs.
Okay, great. So then if those local governments have established relationships, this won't interfere with that. This is definitely meant to kind of be complementary to anything that might be happening within a local entity already.
Margot Chappell, absolutely supportive of, that's exactly the intent, is to support anything that's being done right now. We know, I think the Assemblywoman knows of a program in Southern Nevada, and I'm aware of the one that's called the Nevada Peer Support Network. And so I believe there are a few agencies doing that, and this will definitely allow them not just to exist, but to grow.
I appreciate this. I see one piece, and I know that we are so lacking for money in this state. I know it. But one of the biggest piece of this is, I think, to Assemblywoman Cohen's point, is we have a lot of national data out there that tells us that our first responders are in crisis. We know that for, I think, at least 2 years now running, the #1 cause of death among peace officers is suicide. And now we see a higher rate of suicide among our firefighters. And we see this alarming trend that's growing, and we can't turn a blind eye to it. But I think one of the things that we might be missing is more Nevada specific data. And I think it could be helpful across a large spectrum of conversations. You know, we had a conversation last session about workman's comp and PTSD. We're probably going to be having, I imagine, I don't have a bill, no one freak out, but I imagine that more conversations like that are going to kind of be out there as there's more public awareness about the impact, the social impact that these professions have. And so I don't know if there's the willingness or the ability, but if we're kind of missing a lot of Nevada specific data in a way, I'll just put that out there. But I think it would be helpful because I think more legislators down the road are going to be looking for Nevada specific data and data to help form policy. And I think we're going to be missing that. And we don't really have a collection pot that I know of for things like that. So maybe that's something we could talk more with the locals about too, because it's kind of that missing piece that we need to figure out what's going on in our own backyard.
Leslie Cohen, Assembly District 29. It is something that I really wanted to be able to capture to start to get that data, because I had trouble finding. I had looked for data, couldn't find it. And I think what we're doing here is, even though we're being mindful of money issues, we're at least kind of starting the conversation, opening the door to hopefully, when we're on better financial footing, we can come back in and continue the conversation and get more done.
Thank you. Do we have any other questions from committee members? Looking here, I don't see any messages. I don't see any hands. Well, with that, we will go to testimony in support, opposition, and neutral of Assembly Bill 96, Broadcast Services. Can we begin testimony in support of Assembly Bill 96?
First, Chair. If you would like to testify in support of Assembly Bill 96, please press star 9 now to take your place in the queue. The caller with the last 3 digits, 747, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Madam Chair and committee members, my name for the record is Andrew Lee Pilbit. Last name, L-E, P as in Paul, E-I-L, B as in boy, E, T as in Tom. And I represent the combat wounded veterans of the Purple Heart in the state of Nevada and the 70,000 disabled American veterans in the state of Nevada. And I am the current chair of the United Veterans Legislative Council, where we represent 250,000 vets in our state. And when you count their families, a total of 500,000 Nevadans. We are in support of AB 96, although we did have a single question in addition to that, considering that veterans in military, guard, and families in our state represent around 1/6 of our population. We thought the commission that's being created should have a veteran mental health expert on the team as far as that board's concerned. Other than that, we are in support of AB 96. And thank you for your time today.
Thank you. If we can go to our next caller in support.
The caller with the last 3 digits, 042, please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller with the last 3 digits, 042, please press star 6 to unmute.
Hello, my name is Derek Reed, D-E-R-E-K, Reed, R-E-I-D. I'm the president of the Nevada Peer Support Network that was mentioned earlier. We represent law enforcement, fire, emergency medical service, dispatch, hospital professionals, ski patrol, and any service branch that actually has repetitive trauma exposure. We do have a current website and the list of numbers. I have spoken with Assemblywoman Cohen, and we are in support of this in a collaborative effort to continue to do what we're doing in support of so we can continue to provide were stated earlier. And we appreciate the support. Thank you very much.
Thank you. If we can go to our next caller in support.
Chair, there are no more callers in support at this time.
Wonderful. If we can go to our next, any callers in opposition.
To testify in opposition of Assembly Bill 96, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Are there any callers in neutral?
To testify in neutral of Assembly Bill 96, please press star 9 now to take your place in the queue. Chair, we have no callers in neutral at this time.
Thank you. At the time, if we can go to our bill sponsor, Assemblywoman Cohen, for any closing remarks.
Thank you, Chair. I'm glad Mr. Reed called in and appreciate the support. I would recommend that all members go to the MPSN website. It's certainly, it's very comprehensive. He and his organization have done just phenomenal work at a very short period of time. And everything, it even breaks down to different groups, it doesn't just group all first responders together, but breaks them apart for their special concerns and needs for mental health care and for peer support. With that, the bills, it's not a big bill. It does accomplish, however, important things such as the data collection and getting information about peer support for first responders out there more, and just kind of sets the scene for making sure that we're moving towards doing as much as possible with peer support for first responders as it grows, as I think a movement, and as we financially recover as a state. So thank you. I appreciate everyone's attention, and feel free to reach out to me, anyone in the committee or anyone listening to the hearing who has any questions or suggestions, and I'm very open to that. Thank you.
Thank you, Assemblywoman Cohen. With that, I will close testimony and close the hearing on Assembly Bill 96. And thank you for your presentation. At this time, I'm just going to, we'll begin public comment. Just to remind callers to please clearly state and spell your name and limit your comments to 2 minutes. I will be timing to make sure that we ensure enough time is given for people to testify. And with that, Broadcast Services, do we have anyone on the line in public comment? Excuse me.
To participate in public comment, please press *9 now to take your place in the queue. With the caller with the last 3 digits, 490, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon. My name is Cyrus Hojati, Cyrus Hojjaty. I think we need to really discuss the root problem of our healthcare system, because you talk about homelessness and mental health. I think mental health is very important, especially among homeless people. I think that is why they're in the mess that they are today. But we really need to be talking about serious healthcare reform, because I can tell you that a lot of progressive media outlets are being betrayed by this current administration. There is not going to be Medicare for all. Now, we have to understand, why did the U.S. healthcare actually gotten worse? It's because of the passage of the 1973 HMO Act. When that law was passed, healthcare costs skyrocketed. And the issue is that Wall Street has been the largest beneficiary. Americans are suffering, Wall Street is benefiting. And it's pretty disgusting to see that none of our elected officials, both parties at the federal level, are even talking about this. Now, I think we should have a discussion on Medicare for all. We need to talk about whether this actually works. Now, I would be in favor of it perhaps if other taxes would be lowered, because I don't want to have a big tax burden. And I also would be discussing just ways just to get Wall Street out of our healthcare system. Now, as you know, they're not talking about this because I think Wall Street has an incredible amount of power of our healthcare system. And I just want to know your take. What do you think should be happening to that particular system and prescription drugs? Because it's been skyrocketing, it's been unacceptable, and what can really be done about this? So, I mean, this is really just out of touch. I can tell you that. So let's just sit down and discuss if you have the time. Thank you.
Thank you, Mr. Hojjaty. If we can go to our next caller in public comment.
Chair, the public line is open and working, but there are no more callers at this time.
Thank you. And with that, do we have any comments from members before I adjourn today's meeting? Seeing none, again, thank you all for your patience today. This concludes our meeting. Our next meeting will be on March 19th, so we will have a Friday meeting. I'm looking at what our agenda will look like for next week, so kind of pay attention to your email, and we'll be ready to go. But thank you guys all, and meeting is adjourned.
Thank you, Madam Chair.
Thank you, Chair.
Thank you, Madam Chair.